Hi, this is DrRic with a tutorial on how to begin a meditative practice. If you see me in the clinic, most of the time I'll make recommendations on how to get from point A to point B. Point A being where you are with your health currently, and then point B being 90 years of age to 100 years of age with no suffering. The idea is to have somebody, hopefully me, figure out what the risk factors are at this point in time, what the risk factors are coming up, and make changes or make personal suggestions on a plan to avoid dangers that are coming and get to 90 to 100 years of age without any, hopefully, problems, surgeries, medical diseases, or medicines. So it takes some brainstorming and it takes a lot of investigative work. Usually there's a change in nutrition, a change in movement or exercise, and an introduction of grounding or developing the relaxation response. When I say grounding, one of the questions in my questions and answers to figure out what's going on with my average patient is, how do you ground yourself? And I had a professional mixed martial artist come in, Felice Herrig, and innocently she said she wasn't sure what grounding meant, aside from using jiu-jitsu in the ring or in the cage. Now, grounding is like electricity. Electricity always seeks out going to the ground. That's the common path of electricity. Lightning, as an example. Grounding would be calming, using your ideas about meditation, using your ideas about relaxation, and bringing up those techniques or those ideas, those images during times of stress, or just as a practice during the day. The true meditators, my friends at the Chopra Center, will like to have a regular practice. My friend David G., Deepak, David Simon all suggest part of being healthy, the Ayurveda way of being healthy, is to introduce some form of practice twice a day, at the least. 30 minutes in the morning, 30 minutes at night. Sometimes that's a little bit difficult when you're first beginning, and again, that's why I'm going to try to introduce something real easy. So pretending that you're a patient of mine, no experience in meditation, how do I make suggestions to you? The first thing is to come up with a plan. I've put together, this is my meditation pillow. I actually got this at a pet store. It's a large pet pillow used for sleeping at night. I found it on sale because it was damaged, but it helps with comfort. If you get to the point where you're 30 minutes twice a day and you're on hardwood floors, your ankles, your sit bones, your knees, your toes, anything that's touching the ground will, after about 10 minutes, become painful. And that's something that's a deal breaker. When pain comes on, it usually will interrupt your thought, especially if you're trying to meditate. When you try to develop a practice, I think that diving into the very basics to develop a good groundwork or the basic framework of meditating later is always important. So comfort's number one. This is a Zafu pillow, meditation pillow. It's full of seed, and it helps to mold, makes things comfortable. The thickness of that pillow is for a reason. When the pelvis, when your sit bones are higher than your ankles, you sit on an angle, so your pelvis moves forward. The theory is that when your pelvis is canted a little bit forward, your backbone will align in a more straight position versus sitting up flat on the ground and having the back kind of curve. This gets to be fatiguing after about 30 minutes. You don't have to sit up straight like a military posture. It's just a matter of kind of balancing between front and back until you get to a point where you're effortlessly balancing the lumbar spine, the thoracic spine, cervical spine, neck, and head right on top of the well-balanced pelvis or well-positioned pelvis. So that's the reason for Zafu pillow. the ankle pressure and trying to remove that from the mix, the reason for cushioning underneath. You have to have comfort. So my patients with knee pain, when I do meditative yoga, I allow them to either have the legs straight out or put supporting blocks underneath the knees so they don't have to work on bringing the leg up during the time that they're trying to meditate. There's also, at the Chopra Center, I learned about these things called back jacks, where you can actually sit back and it supports the back. Cushion on the bottom. For those of you who have poor trunk stability or have to work on abs, it allows you to lean back a bit. Again, if we can take out all the noise from the body that will like to interrupt at about the 10 to 30 minute mark, it will be helpful. Taking out the noise from the environment, also very helpful. So my moms who meditate or only have the morning to themselves, I try to tell them to carve out 10 minutes earlier than usual to get up and spend 10 minutes, either brew the tea, have it with you, start to smell the tea, and then use that as your 10 minutes. Even if it's once a day, it's better than nothing. You don't have to have, these are mala beads. Mala beads you can find at any, I bought these at the Chopra Center. You can buy them if you're in Illinois at Quest Bookstore in Winfield. That's where I bought the Zafu pillow. You can get them online at several different outlets. Even, again, Chopra Center has it online too. So these are facilitators to meditate. Sometimes if you roll the bead and repeat a mantra, then it helps you stay on focus or on the pace of rolling the bead, repeating the mantra, and continuing on with breath. So it's just another way. There's nothing religious about this. It's just another way to, another vehicle to get you to a state where you're kind of letting go of the noise, the distractions from the outside world, and letting your brain kind of relax in stillness. My patients who have anxiety, my young folks, my adolescents and my college levels kids, very difficult to introduce meditation unless they're athletes. Then they kind of, most athletes will kind of know the getting in the zone technique that they use prior to a game or prior to competition. If you're not an athlete, it's sometimes very hard, especially with today and the internet. The internet and computer work allows us to see rapid information that's always available. One click and you see the next video. One click and you see the next bunch of information. So it allows for, it embellishes a rapid response and a rapid ask and a rapid answer. Sometimes it's not healthy, especially with all the ADHD or AD without HD, the attentive disorders of youth and adulthood. If we're not used to slowing down, it makes the body a little irritated to not have stimulation. So it's okay to kind of feel that, and when you get distracted because the mind is saying it's not comfortable with silence and stillness, then go back to the mantra, go back to the bead rolling, go back to the breath work and observing your breath. Other posts on YouTube are for DrRic breath awareness meditation. I think I have about 5 different ways to practice breath awareness meditation, and all 5 are just ways to use the breath as a focus point so that you kind of let go of what's going on around you. Again, if you can develop an awareness of something on the inside that's timed, regular rhythm, like breath, then it's easy to concentrate and focus on that. And when you focus on that, you actually get so hypnotized by just that the brain, that's the stillness that we always shoot for. That's the brain not paying attention to the kids that are crying, the vehicles outside, the noises from the fridge. So those are techniques that we can do. Mantra, as I mentioned earlier. Mantra is a mind tool. That's the translation in Sanskrit. Tool to help the mind settle. I don't like to use the words a tool to control the mind. It sounds too 60s, but a tool to help the mind settle is using a mantra. In Ayurveda or the Chopra Center, there's a specific mantra that's the sound that the earth made, or sound of the day when you were born. Something special about going back during that time, figuring out the sound, the vibration of the earth at that time, and repeating it over and over again. That's a fancy way you can get a mantra. Herb Benson at Harvard taught me that, mantra can be a sound, a word, a phrase, or a prayer. And if you just pick one that's easy to recite, easy to repeat, you just repeat that, maybe link it to your breath in, saying the mantra, breath out. Breath in, repeating the mantra in your mind, breath out. You keep on doing that at a slow pace, and you'll again fall into the hypnotic circadian, the rhythm of that, so that after a while, if you do get distracted or if you're antsy, it's okay, let go of that antsiness, that thought, that pain that you might be feeling. Be aware of it, let go of it, go back to the breathing, go back to the mantra, go back to relaxation. So that's the idea about how to begin a practice. Comfort, something to rely on as far as distracting, getting away from the distractions. If that's very hard and you can't sit still, then you get professionals, you get teachers to guide you into relaxation. There's things called guided imagery. I have a great friend who graduated with me at the Chopra Center. He's actually one of the teachers, David G. If you look on his website, fantastic. He's a fantastic lecturer, but he also is a great guide if you want to meditate. He has 2 CDs out. I highly suggest it. I'll put a link underneath so you can see it. Ava Selhub out of Harvard, one of my contacts at the Benson Henry Institute, is also has a nice CD out. Very good voice. Guides you into relaxation. Sometimes people will need to hear the guided word to get into a point of relaxation, and that's okay. I think that silence and stillness is always what we try to shoot for. But if it's too hard to figure out on your own, get somebody to help you meditate. Eventually, if you do practice and fall in love with that form of meditation, that certain amount of time per day, and it's usually 10 to 30 minutes at the beginning and end of your day, sooner or later you'll actually want to expand more into silence, and you'll know when that occurs. When you get bored of your usual, try to dive into actual tutorial or going out and meeting with David G. or Herb Benson or Andy Weil in the Integrative Medicine Center in Arizona. But you'll seek it out. You can actually look into your local yoga studios, and most likely there'll be a meditation or a healing lecture at one of the local yoga studios. Just have to search out. The other thing is also to not meditate on a full stomach. If you're full with your vitamins, if you're full with alcohol, if you're full with caffeine, if you're full with too much food, it's a distraction. Aches and pains are a distraction. So it makes it harder. You can certainly do it with that, but it makes it harder to start with developing a practice. The folks at Harvard actually do meditation in cancer wards, in ICUs, and there's always noise and activity going on in wards on the floor in the hospital, but yet they've been able to incite, develop, and help patients in the guided imagery, in meditation. So it can be done. It just, at that point, you need really a good tutor to show you how to do it. But on your own, if you can start with comfort, if you can have some form of a mantra or some form of repetition that you can rely on, and then if you can take away all distractions, hopefully you can do that 10 to 30 minutes in the morning, 10 to 30 minutes at night, and finally, after about 21 days, you usually will set the rhythm for meditation. I will tell my patients to meditate at night. I usually will tell them to avoid doing it in bed, because when you're lying down, most people are so tired they go to sleep. And it's okay if you're a beginner to try to go through the breath awareness meditation right as you're going to sleep when you're lying down. But the idea is not to actually fall asleep, because it's so easy to do that when you're lying down. The idea is to perhaps close the eyes gently, take away the distractions, and learn to have the brain rest without falling asleep, without being unconscious. It might be a little hard to understand that, but those are the practices. If you have no choice, just do it in bed when you first wake up, when you're about to go to sleep, and it's better than nothing. But again, The idea would be usually a seated position. If you have knee pains, as I mentioned, you can use support. You can actually do it in a chair if you want to, or outside with nature, as you've seen in previous posts and videos of mine. The final thing I'll suggest is that if you're not used to time, 10 to 30 minutes, you'll have to have some kind of reminder to bring you out. And I wouldn't use an alarm clock. Sometimes it's not healthy to be in meditation and have a knock kind of bring you out of meditation. That's kind of shocking. It's not a good memory for the brain to say that's how I usually come out of meditation. So I've downloaded Insight Timer. You can all get your own, but Insight Timer gives you different Tibetan bowls. I'm not sure if you can hear that. This is online. You can time it for 30, I think up to 2 hours to 6 hours. And the cool thing about Insight Timer, and I don't get any benefit from them, but cool thing is you can actually also see, there's an app where you can also see who else in the world is meditating at the same time that you're meditating. It's pretty cool. When you meditate with a group, even if you're a beginner, it will usually imbibe the energy of the group. So even if you're a beginner, by the time the whole group is finished, you'll actually take some of the energy and good feelings that the group is going through. And that's the great benefit of the Chopra Center. You can meditate with 600 people in the same room. And even if you're a beginner, you'll usually feel pretty good at the end of the meditation.